C4, 5, and 6 spinal cord compression. How? That's where you start. How did it happen, right? What got it going? Where did this compression become? Was it a whiplash injury from the head getting snapped? Was there a trauma? Was there something that occurred in there that got it all going, right? So once you kind of look at that, you figure that out, then you have to look at things. Remember, it's a twofold thing. The body will adapt within reason, but sometimes tissue gets damaged so much that it needs some kind of intervention. You break an arm, you don't just say heal, 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 heal. It doesn't. You got to put it back manually. Sometimes they go through, they clean things out. Sometimes they'll go through and put plates in and lock it all up. Those are all things, but then you still have to work around the muscles, the tissue, and things of that. Depending on how compressed it is, determines on what you may have to do. If it's, complete cord compression, you're going to be paralyzed. If it's not, you might have some pretty good range of motion and movement like that. I've had patients over the years that have had severe spinal stenosis and compression issues that have gone through and done very good surgical work, and after they did that, then our treatments all of a sudden just took off and everything got better. But they had to stabilize that piece. The thing I would tell you, and this is my personal preference, one of my mentors, a doctor by the name of Victor Frank, years ago, and I'm not trying to insult physicians here, said I would never let an orthopedic physician near my spine. Ever. Ever. Okay, and I asked him why. He said, "You ever watch a knee replacement? They take a rod and a hammer and they're banging away." He goes, "They're kind of like a carpenter. Now, they're talented and they're very good, but they're like a carpenter in that sense." He goes, "You don't want a carpenter messing around with those fine, delicate nerves. You wouldn't let an ortho guy get up in the brain," right? So, and I'm not trying to be hard on them. I'm trying to say that there's levels of this. So when patients come to me, if they have a hip problem, ortho, knee problem, ortho, shoulder, wrist, elbow, ortho. When you get into that cord where that big wire is there and it's super critical and important, I tend to steer them away from the ortho groups, and I tend to steer them more towards the neurosurgeons or the micro neurosurgeons. Those are the ones that do it. And Victor Frank, when he was mentoring me, always said, look, the neurosurgeon would be the equivalent of a fine carpenter.
Yeah.
Woodworker, someone that's carving spindles and doing things of that nature. The micro neurosurgeon, if you can find them, they're hard to find, are like jewelers. You don't hand the ortho guy a diamond to split. He's like building a house. And he can build a beautiful house. But when you get into those fine things that really, really, really matter, I like to be with people that's all they do, right? They focus on those little meticulous fine things.